How do inflammation and stress cause wound dehiscence after surgery? Imagine your body as a busy construction site after surgery. The goal is to rebuild and close the wound securely. But sometimes things go wrong and the wound reopens. That's what we call wound dehiscence. Now, let's look at how inflammation and stress can cause this problem. After surgery, your body naturally responds with inflammation. This is a good thing because it helps fight infection and starts healing. But if inflammation lasts too long or becomes too intense, it can actually harm the tissues around the wound. Excessive inflammation breaks down important materials like collagen, which are needed to hold the wound edges together. When these materials are damaged, the wound becomes weaker and more likely to reopen. Stress on the wound is another big factor. This stress can come from everyday activities like coughing, sneezing, or even heavy lifting. It can also happen from internal pressure inside the abdomen or chest. When the wound is under too much tension, the stitches or staples that hold the wound closed can start to pull apart. If the tissue is already weakened by inflammation, this mechanical stress makes it easier for the wound to tear or open. Both inflammation and stress often work together. For example, if an infection causes inflammation, the tissue becomes weaker. Then, activities like coughing or moving too much can cause the wound to stretch or tear open. This is why it's so important to follow your doctor's advice after surgery. To prevent wound dehiscence, patients should take medications as prescribed to control inflammation and infection. Keeping the wound clean and dry is also key. Avoid activities that put pressure on the wound, like heavy lifting or vigorous movement. If you notice redness, swelling, pain, or if the wound starts to open, contact your healthcare provider immediately. Understanding how inflammation and stress affect wound healing helps you protect your recovery. By managing these factors carefully, you can reduce the risk of your wound reopening and ensure a smoother healing process.